now I have the honor of introducing our next speaker, Dr. Courtney Peterson, PhD. Dr. Courtney Peterson is an associate professor in nutrition sciences at the University of Alabama at Birmingham and an internationally recognized researcher in the field of intermittent fasting and meal timing. Dr. Peterson conducted the first controlled feeding trial of intermittent fasting in humans and was the first to test early time-restricted eating, also known as early TRE, in humans. Her research has shown that early TRE introduces weight loss, alters hunger, improves glycemic control, lowers blood pressure, decreases oxidative stress, activates anti-aging pathways, increases autophagy, and improves metabolic flexibility, but does not affect energy expenditure, and that many of these effects are independent of weight loss. Currently, she is the principal investigator, or PI, MPI or site PI of 7 clinical trials on time-restricted eating, including a couple of the largest studies of intermittent fasting in humans. Dr. Peterson has clinical trials of TRE in patients with type 2 diabetes, prediabetes, cancer, and in healthy midlife adults to see if TRE can slow the aging process. She's also a consultant or collaborator on another 6 clinical trials on intermittent fasting. Her research has been featured in more than 100 media outlets, including NBC Nightly News, The Wall Street Journal, The New York Times, The Washington Post, Good Morning America, and the BBC. And today she is here with us. So thank you very much, Dr. Peterson, and I turn it over to you.
Thank you so much for having me. I'm going to load my slides. Well, fantastic. Thank you so much for inviting me to this amazing symposium. So I'm going to talk today and answer the question, do intermittent fasting and time-restricted eating promote well-being? Now, well-being is a broad term. Oftentimes we think about social and emotional well-being or health, but I would say it also just sort of encompasses the whole spectrum of health outcomes. So I'm going to review the data on a wide spectrum of health outcomes. And I have no disclosures. So intermittent fasting is sort of defined as any sort of meal timing intervention or approach that alternates periods of eating and extended fasting. And for my talk today, I'm going to use a 14-hour definition, meaning you have to be fasting for at least 14 hours at a time. And this is based on a recent international consensus committee that is now defining intermittent fasting as fasting for at least 14 hours, at least in humans. I also like this definition of 14 hours or longer for 2 reasons. So one, if you look at data from NHANES, which is one of the largest nutritional assessments of Americans, the median American currently eats over about a 12-hour period every day. So I'm reluctant to say that fasting for 12 hours is generally should be considered as fasting. And then second, if you look at substrate oxidation as a function of the number of hours someone's been fasting, we really don't see a big upregulation of fatty acid oxidation and gluconeogenesis until more like 14 to 20 hours of fasting. So I think 14 hours is a really good definition for practical purposes. So there are many types of intermittent fasting that have been studied in humans, and they're really quite diverse. So to give you a flavor of them, here are among some of the most popular forms of intermittent fasting studied in humans. Now, to make sense of all these different types of intermittent fasting, I like to kind of broadly group them into 3 different categories. The first type of category I call periodic fasting. This is not a widely recognized term in the literature, but bear with me. So this sort of category of approaches are approaches where you fast for 24 hours or longer, some number of times per week or per month. And examples of this would be fasting 1 day a week, which is common in many religious traditions, or alternate day fasting, ADF. This is where you fast, have a complete 24-hour water-only fast every other day. The sort of second category of approaches I would call intermittent energy restriction. So these are approaches that involve modified fasting. So instead of a complete 24-hour water-only fast, you're eating a very low-calorie diet. And we know eating a very low-calorie diet recapitulates many of the benefits of fasting. And examples of this would be alternate day modified fasting, where every other day you approximately eat the equivalent of 1 meal a day. the 5-2 diet, where you pick 2 days a week, either consecutive or non-consecutive, to eat a very low calorie diet, again, about the equivalent of 1 meal a day, or the fasting mimicking diet, which Walter has just walked us through. And the third sort of category of approaches are your daily intermittent fasting approaches, which are now known as time-restricted eating in humans or time-restricted feeding in animals. And in these types of approaches, you're compressing your sort of daily eating window into a smaller number of hours each day, and you're picking a consistent time to do that each day. So you can do that by either eating breakfast later in the day and or dinner earlier in the day. So you're kind of extending your sort of nighttime or overnight fast. So let's kind of go through some of the evidence that fasting or intermittent fasting can improve well-being. So let's start first by looking at fasting 1 day a week, which is common in many religious traditions. So one of the best studies we have on this is the Wonderful trial, which was done by Ben Horn. And this was a 26-week trial in 103 adults, where they were either they either fasted 1 day a week. It was not a randomized study, but they either fasted 1 day a week or they were non-fasting. And they were followed for roughly half a year. Now, they found actually really good adherence in this study, so about 95% of adherence. And body weight wasn't quite statistically different between group, but you can see there was a statistical trend here for a sort of greater, roughly 3-pound difference in decrease in body weight. However, they did find improvements in insulin resistance as measured by HOMA-IR in the intermittent fasting group. And they also found improvements in the metabolic syndrome score here, as you can see as well. Unfortunately, they did not find any statistically significant improvements in brain-derived neurotropic factor or in scores indicating cognition. The second type of intermittent fasting that's been reasonably well studied in the literature is alternate day fasting, or ADF. So in this sort of approach, you alternate 24-hour water-only fasting with ad libitum eating. And back when the first studies on this were done, we really didn't know if intermittent fasting induced weight loss in the long term, because there's some possibility that individuals could compensate and then overeat, or at least eat enough to kind of bring them back into energy balance. So one of the first studies was done by my postdoctoral mentor, Eric Ravison, at Pennington Biomedical Research Center. And this was about a 3-week study in 16 people. And interestingly, they did find that alternate day fasting induced weight loss in sort of this zigzag pattern here. So it was sort of sustainable over the long term. People didn't eat enough on the ad libitum days to offset the weight loss. But interestingly, in the same study, they found that hunger levels essentially went through the roof. People were hangry. And if you read between the lines, they conclude that alternate day fasting is likely not sustainable. So we actually don't see very much research anymore on this type of intermittent fasting. Nonetheless, there are a couple interesting studies that I want to show you. So this is sort of the best quality evidence we have on alternate day fasting. So this, I'm going to show you results from a study published in Cell Metabolism, as well as 2 other studies. So in one of these studies, they took 60 adults without obesity, and they randomized them for 4 weeks to alternate day fasting or a control eating schedule. And they did indeed find that alternate day fasting reduced body weight. It also reduced blood pressure. It reduced heart rate. It also reduced the Framingham risk score. And there was some evidence as well that it might even improve thyroid hormones and increase ketone levels. In a second study published by the same authors, they did a sort of longer-term cohort study in 90 adults without obesity, and this was a 6-month-long study, so it's sort of more of like kind of a case control study. And they also found that alternate day fasting in the long term does reduce body weight, and it improves very similar CVD outcomes as their randomized control trial. But in addition, they found that in the long term, alternate day fasting lowered cholesterol levels and sort of other markers, including some certain like immune related markers. But interestingly, they found that alternate day fasting was a third study found that alternate day fasting, this is the Catenacci et al. Study here, found that alternate day fasting was not any better than CR. suggesting that the most of the effects are actually from losing weight. The third type of intermittent fasting that's been appreciably studied in the literature is alternate day modified fasting, or ADMF. And really, Dr. Krista Verdi, who's at the University of Illinois at Chicago, is really the one who put this type of intermittent fasting on the map. And she did a lot of pilot studies in the early day on this type of intermittent fasting. And the way that she typically implements these studies is that she will have participants alternate fast days where they will typically eat about 25% of their daily caloric needs, with feast days, which are ad libitum, and typically participants will eat more than they usually need to maintain their weight, but it's not enough to offset the calorie deficit on the fast days. One of the first RCTs that she did that was sort of larger in scale was this 12-week RCT in 32 adults without obesity. And she found that alternate day modified fasting does indeed improve body weight, as you can see here. And it does reduce fat mass and fat-free mass. And if you look at the ratio of the two, it's not selectively or negatively affecting fat-free mass, which you can think of roughly as skeletal muscle mass plus organ mass. In that same study, she also found that alternate day modified fasting reduced lipid levels and improved the inflammatory marker C-reactive protein. And a little bit more recently, we also have evidence that other aspects, that ADMF may improve other aspects of health. So in an 8-week-long RCT in 32 adults with metabolic associated fatty liver disease, the alternate day fasting did improve ALT levels. It reduced liver steatosis, and it also reduced measures of liver stiffness. And then even more recent, and around the same time, she also did a really elegant study comparing alternate day modified fasting versus habitual eating patterns, and also versus CR. So this was a 3-arm randomized controlled trial in 100 adults with obesity. And they followed their assigned group for 1 year. So the first group basically was told to maintain their body weight, not change their eating habits. And those are these open circles here. The second group was alternate day modified fasting, these triangles here. And every other day they ate approximately 25% of their daily caloric needs. And then the dietary restriction group here, they were counseled to cut their calories by the same amount overall, but they were just asked to do that on a daily basis rather than on an every other day basis. And interestingly, what you can see here is they found absolutely no differences in body weight between the CR or calorie restriction groups and the alternate day modified fasting groups, although both groups clearly did much better than the control group. And they also found absolutely no differences in any cardiometabolic risk factors between alternate day modified fasting and CR. So there's no difference in inflammatory markers, visceral fat, blood pressure, glucose, insulin, and so forth. So then you could sort of conclude that alternate day modified fasting is equivalent to calorie restriction or calorie counting, no better or no worse. However, unfortunately, in this study, the dropout rate for the alternate day modified fasting group was a bit higher than for kind of standard calorie counting. So it did sort of suggest that alternate day modified fasting is not quite as feasible as classic calorie counting. There is a little bit of good news though. So alternate day modified fasting still improves health overall relative to baseline or not cutting calories. In addition, there's some other studies finding that alternate day modified fasting improves other health outcomes. So for instance, Krista Vardy's team also did this very nice post-hoc analysis in the same group of 100 adults. And they did indeed find in individuals who are insulin resistant at baseline that they experienced greater improvements in insulin and HOMA-IR when they were assigned to the alternate day modified fasting group. And then another 8-week-long randomized controlled trial in 56 women with overweight found that alternate day modified fasting did improve some aspects of sleep quality. So it does improve sort of self-reported subjective sleep quality, and it also reduces daytime dysfunction. So which is sort of the issue of sort of sleep interfering with daytime functioning. So things like falling asleep while driving or while you should be awake during the day. The next type of intermittent fasting that I want to mention is the 5-2 diet. So this is an approach that involves eating a very low calorie diet twice a week. So to me, this is basically a less extreme version of alternate day modified fasting. Instead of doing this every other day, you just pick 2 days a week to have as your modified fasting days. The interesting thing is these days can be consecutive or non-consecutive, so it's up to patient preference. And this type of approach has actually over 25 clinical trials on it, so it's a really large number. I think when I first started giving these talks, we only had 4 studies on it, so it's just exploded in popularity. And it's actually most popular in Europe. You don't hear many people following it in the US, but it's extremely popular there based on a BBC documentary that was done many years ago. And one of the first studies that put this type of approach on the map was a study done by Michelle Harvey and Anthony Howell back in 2013. And they did a 3-month-long study in 115 overweight women with a family history of breast cancer. And they compared they compared the 5-2 diet versus continuous energy restriction, which is essentially just means the same thing as CR. And what they found is the 5-2 diet was actually better at reducing body fat levels, insulin levels, and insulin resistance than CR. And this sort of dovetails with some of those results I showed you earlier from Krista Verity's lab. And so this was among some of the first evidence we have that intermittent fasting actually may be better than calorie restriction. There may actually be some benefits independent of how much you eat. Today, we now have 5 one-year-long randomized controlled trials with about 50 to 110 patients per group. So this is fantastic. We're starting to get to the place where we're having higher quality clinical trials. And the very interesting thing, if you look at these studies, is they all tend to report, well, actually, sorry, let me take that back. About half of them tend to report that the 5-2 diet induces greater weight loss around the 6 to 12 week mark. And here's an example from one of those studies where they compared a control group versus sort of classic calorie restriction versus intermittent fasting in the form of the 5-2 diet. And you can really see at the 12-month mark that the intermittent fasting group has done the best. However, once you get to the 1-year mark, all of the studies conclude there's no difference between the 5-2 diet and classic calorie counting. And the reason for this is the studies have all traced it back to waning adherence. People just tend not to be able to stick with the 5-2 diet long term. And in fact, their adherence at the 1-year mark is about half of what it is at the 3-month mark. Now, the good news is the 5-2 diet in all these studies does improve cardiometabolic risk factors relative to either a control eating schedule or to baseline. So absolutely no question there that improves health. But relative to calorie counting, it doesn't seem to improve health any better or worse, with the sole exception that at least one study did report that the 5-2 diet improved postprandial C-peptide levels better than calorie restriction, so meaning that it improved insulin secretion. And then also that it reduces postprandial triglyceride levels, which are an independent risk factor for cardiovascular disease, better than calorie restriction. And now we're even getting evidence that the 5-2 diet may be helpful in the case of type 2 diabetes. So we now have 2 really quite large sort of 12 to 16 week long randomized controlled trials with sample sizes of over 100 per group, testing whether the 5-2 diet can improve glycemic control. And here's the results here, sort of on the right-hand side of the slide from the first study and the second study. Now, in the first study, they compared the 5-2 diet, shown in orange here, versus an exercise group versus a control group in gray. And they found that the 5-2 diet was superior, at least at the 12-week mark, at improving hemoglobin A1C. And then it also increased the fraction of patients who were able to achieve remission from type 2 diabetes, and you can see that here. And in another study, very nice study published in JAMA Network Open, another team of investigators compared the 5-2 diet combined with meal replacements. So it was a very clever study design. They helped participants adhere to the 5-2 diet by giving them meal replacements on that day, which I think is a brilliant way to combine the two. And they compared that with prescribing the patients either metformin or an SGLT2 inhibitor. And again, they found that that intermittent fasting actually even outperformed pharmacotherapy in this case, and similarly also increased the number of patients with better controlled blood sugar levels. And now we also are starting to get evidence that the 5-2 diet may improve liver health. So we now have a handful of RCTs, all between 8 to 12 weeks long with, okay sample sizes, but they all universally find that the 5-2 diet may reduce metabolic associated fatty liver disease, as well as steatotic liver disease. And the types of changes that typically report are reductions in overall liver fat. And you can see here the 5-2 diet is performing just as well as a low carb, high fat diet. And there's also evidence that it reduces steatosis, fibrosis, improves indication, sort of liver markers, and then also lipid levels, and reduces inflammation. And also we're starting to see people, really, I've said, even in the last year or two, I've seen a huge increase in intermittent fasting to sort of treat cognitive disorders and improve brain health, which I think is very exciting. So this work, I believe, came out of Mark Matson's lab at the NIA, although I think he might be at Hopkins now, but they compared a 5-2 diet versus prescription for basically healthy living in 40 older adults who had insulin resistance. And through some really clever experiments, they were able to show that the 5-2 diet actually reduced neuronal insulin resistance, and they measured this through exosomes. It also improved the brain age score. It improved recall, and it improved other measures of cognitive function, including executive function. So very, very cool study. The next type of approach, which I will briefly discuss, which Walter did obviously a fantastic job on, so I'm just going to delve on a couple aspects of the fasting mimicking diet that he has not discussed, is the fasting mimicking diet. I sort of think of the fasting mimicking diet as a form of intermittent energy restriction, but as Walter discussed, it's actually a little bit beyond that, because you also have this prescription that it's a plant-based diet and that it's low in protein. But in any case, one of the first larger studies that Walter's group did was a study in 100 healthy adults, comparing the 3 cycles of the fasting mimicking diet versus basically a control group, which didn't change their habits. And what they found in this study, as is no surprise, is the fasting mimicking diet reduced body weight and BMI. It reduced body fat. It also reduced visceral fat, hepatic fat fraction. In the main analysis, there were no differences in glucose levels, but in a subgroup analysis among individuals with prediabetes, it did decrease glucose levels. It also decreases IGF-1 levels, as Walter has said, and it improves blood pressure. And then further subgroup analyses have also found positive results for lipids and inflammatory markers. And another really cool thing that I'm, happy to present on is the fasting mimicking diet also appears to reduce biological age. So in this same study by Walter's team, he found the fasting mimicking diet reduced biological age by about 2.5 years. You can see that kind of by the shift in this curve to the left. And it also has improves the lymphoid myeloid ratio as well, which is sort of a measure of age. And then there have been some really cool studies looking at other aspects of health, sort of things that researchers don't study as often, but which are also super important to a lot of people. So there's also evidence saying that fasting mimicking diet improves psychological health and even skin quality. So in one study, which is a 3-month-long RCT in 20 patients, they compared psychotherapy with time-restricted eating versus psychotherapy alone. And they found that the addition of time-restricted eating improved psychological health more than psychotherapy alone, which is fantastic. And it also improves self-esteem. Some of this may be driven by the weight loss involved. And these folks, I will say, they were followed up for a total of 6 months. So that could be a component there. And the other study I wanted to highlight, they actually looked at the effects on skin. So this was a 3-month-long RCT in 45 healthy adults. And they found that the fasting mimicking diet improved facial skin, and specifically it improved skin hydration and skin texture as measured by skin roughness. And they also reported that participants also reported that it improved their happiness and their confidence. And then lastly, on the fasting mimicking diet, there's also evidence that it may be really helpful for either inducing diabetes remission or reducing the need for medication. So we now have 2 one-year-long RCTs in adults with type 2 diabetes. And both of those studies reported that the fasting mimicking diet reduced hemoglobin A1C, which is a measure of glycemic or blood sugar control. And one of those studies even found remission in up to 47% of patients enrolled, which is fantastic. And then it also reduces medication use as measured by the medication effect score. So you can see here over time, patients are needing fewer medications, which is really exciting. And there was sort of a cost analysis of the savings from using a fasting mimicking diet, and it cut medication costs by about 77%. So that's fantastic. And then the last type of intermittent fasting, which I believe now is the most popular form of intermittent fasting, is time-restricted eating, or TRE. And interestingly, studies report that now between 10 and 12% of all Americans are currently practicing intermittent fasting. So that's very exciting. In time-restricted eating, sort of what that involves is eating within a consistent 10-hour or less daily period, so fasting for at least 14 hours a day. The most common form of time-restricted eating is the 16-8 diet, so 16 hours of fasting and then an 8-hour eating window. And what's sort of different about time-restricted eating relative to these other intermittent fasting approaches is that it involves counting time, not calories. So there's not a specific calorie prescription that you're trying to meet. So it's not like you're eating 0 calories a day or you're trying to target 800 calories a day. You're just counting time. And so what that means is the neat thing about time-restricted eating is you can practice it both with and without cutting calories. So you don't even have to do this for weight loss if you don't want to. Now, one of the first studies to really look at time-restricted eating was a study out of Krista Verdi's lab. This was a 12-week long study with historical controls. She tested an 8-hour window starting at 10 a.m. and ending at 6 p.m. in 23 adults with obesity. And what she found is that time-restricted eating did decrease body weight. The effect was about 2.5% in 12 weeks, which is less than what she typically saw with other forms of intermittent fasting. Well, one of the nice things about this is participants achieved this sort of weight loss without even trying, meaning they spontaneously lost weight. They didn't have to deliberately try to say, okay, I'm only going to eat 1 meal a day. They just naturally ate less and lost weight. And then the other thing is that adherence is really quite high for these types of intermittent fasting. So when they measured adherence, it tended to vary between about 5 and 6 days a week, but the average was about 5.5 days a week, or about 80% adherence. And we now have adherence measured in over 3 dozen studies, and it does seem that the average adherence is about 5.5 days a week, and that's been maintained for even up to a year. So we're really seeing good adherence and feasibility results with these types of intermittent fasting. We now have more than 125, probably even 150 studies now of TRE in humans. Now, most of the evidence we have is not very strong, meaning that the studies are either small, they're short in duration, many of them lack a control group. Though we are starting to see more and more studies breaking that 100 sort of person mark these days, which is exciting. Nonetheless, if you pull the results from all these studies, the last probably half a dozen meta-analyses have all consistently concluded that time-restricted eating reduces body weight. So here's data from one of those where they pulled the results of 17 RCTs, and they found that it induced about 2% weight loss relative to the control group. My lab also did a study looking at whether time-restricted eating could improve weight loss. And one of the neat things we did in that study is we actually wanted to use the weight loss data to kind of model and figure out what's the equivalent energy deficit that it induces, what's the calorie deficit it induces, because those of us who do diet research, you can give people food records and often they'll underreport what they're actually eating. But in any case, what we did in this study is we took 90 patients with obesity, and for 14 weeks, we randomized them to either practice time-restricted eating by eating early in the day, or to follow a control schedule where they ate over 12 hours a day or longer. And in addition, participants will all counsel to lose weight. So we were interested in the question like, if you're trying to lose weight, can time-restricted eating help you lose more weight? And here's what we found. We found that time-restricted eating did induce more weight loss. And you can see sort of the effects widening there. And this was statistically significant. And when we went back and modeled the data, we found that deficit induced was about 214 calories when we looked at all participants, so meaning even the folks who did not adhere to time-restricted eating. And then when we looked at the subset of people who really did adhere to time-restricted eating, which we defined as 5 days a week, every week, the effect was about 350 calories a day. So this is about a moderate or medium-sized calorie deficit. It's the equivalent to losing about half a pound a week. So, nothing to sneeze at there. And then more recently, I will say there was a really nice study published in Nature Medicine. It was a 3-month-long RCT in about 200 adults with obesity. And in that particular study, they did food records and they similarly found that energy intake was reduced by about 250 calories a day. So it's equivalent to about losing a really nice rough rule of thumb is it's equivalent to losing about 1% of your body weight per month. And indeed, in this study, they found time-restricted eating, regardless of the time you practiced it, whether you ate early in the day, late in the day, or you self-selected your window, help people lose about 3% of their body weight in 3 months. So again, that 1% per month rule is very helpful. So we're seeing this replicated again and again, which is fantastic. Now, in sort of the early days of time-restricted eating research, I was very interested in the question, why does intermittent fasting help people lose weight? Is it because it helps them burn more calories, or is it because they helps them actually eat less? Does it suppress appetite? So we did a 4-day-long randomized controlled trial in adults with overweight, where we, at the end of the 4 days, we stuck them in a metabolic chamber for 24 hours and we measured how many calories they burned. Unfortunately, we found that intermittent fasting does not help people burn more calories. There's no magic calorie burning effect. But on the flip side, we did find that it suppressed appetite. And we looked at both subjective and objective measures of appetite. And for instance, we found that time-restricted eating actually reduced ghrelin levels, which is a hunger hormone in the morning. So we did find evidence that it was affecting hunger hormones. One of the other really interesting things we found by putting people in that metabolic chamber is that time-restricted eating sort of alters these daily periods of fat burning. So we did find an increase in total fat burning, but we also find this general pattern that if you put someone on a time-restricted eating diet, during the daytime, they're not burning more or less fat than someone who's on a normal diet. But starting at night, for us, it was around, 8 p.m., 9 p.m., we see actually a big increase in fat burning in the middle of the night. And actually, this is the control group. So lower values here means more fat burning, but we see that the body is really shifting to this fat burning mode. And that's really important because conceptually, we think a lot of the benefits of intermittent fasting are from the fact that we're just kind of extending or dipping deeper into a sort of fat burning mode. We're really altering sort of the underlying metabolism and physiology that sort of people go through on these daily cycles. Now, a related question concerns body composition. How does TRE affect body composition? It's great that it induces weight loss. Could it potentially negatively affect muscle mass? And we find absolutely no evidence it does. We find it does slightly decrease total body water. So there are a couple studies reporting lower effects on lean mass, but it seems to be solely due to reducing total body water, which has been measured separately. And moreover, in studies looking at things like muscle protein synthesis, you can see here there's absolutely no negative effects of TRE on muscle protein synthesis. And then there have been several studies, at least half a dozen, looking at the effects of time-restricted eating on either muscle mass accretion during resistance training or in strength gains. And there was absolutely no negative impact on the ability to build muscle and no negative impact on the ability to gain strength or muscle performance. So for instance, if you look at pre and post measures in those who are on time-restricted eating versus a control diet, you can see both are about equally gaining strength during a leg press and also during a bench press. So we really don't see any impairments there, which is great. We now have about 4 one-year-long RCTs of time-restricted eating, and all report really good adherence around about 6 days a week. So unlike other types of intermittent fasting, TRE does seem to be more feasible. In one of these studies, they actually compared TRE versus calorie restriction versus the control group. Again, this is from Krista Verdi's lab. And the interesting thing they found in these individuals as compared to the control group. TRE did reduce body weight, and it was about 4.5% in this study. I think it was about 4.5. And it also improved cardiometabolic endpoints. But relative to calorie restriction or calorie counting, it was no better or worse. So you might take that as bad news, but actually take that as good news, because most people do not like counting calories. And so time-restricted eating becomes an alternative way to lose weight and get the benefits of calorie restriction without actually having to count calories. And now there's also evidence that time-restricted eating can improve cardiometabolic health. We have about a half dozen studies now in patients with type 2 diabetes, and they pretty much universally all report improvements in glycemic control. The largest of these studies was done in China and 120 adults with type 2 diabetes. And in that particular study, they found that eating in a 10-hour window improved glycemic control as measured by hemoglobin A1C. It also reduced insulin levels, HOMA-IR levels, and reduced medication use. And then other studies have similarly reported improvements either in hemoglobin A1C levels or in other metrics such as time in range. So when people wear continuous glucose monitors, we can actually measure their glucose levels over the course of the day. And our goal there is to keep them in a tight range. We don't want those glucose levels to be too high. And what we see with time-restricted eating is it actually reduces a lot of those spikes in blood sugar levels. And in this particular study, they found improvements in 24-hour CGM levels in the absence of weight loss. So also very encouraging. There's also data that time-restricted eating may improve metabolic syndrome and prediabetes. So in one study, one of the first to look at the effects in patients with metabolic syndrome, it was a 12-week single-arm study in 19 adults with metabolic syndrome, and they found that TRE reduced body weight, BMI, waist circumference, visceral fat, and blood pressure, as well as some lipid levels. And then in another study, one of the first in patients with prediabetes, they took 101 overweight adults with prediabetes, and they randomized them to TRE or a control group for 3 weeks, and they found that 8-hour time-restricted eating improved body weight, fasting glucose, triglycerides, and HDL cholesterol. My lab a few years ago was interested in the question of whether TRE can improve cardiometabolic health independent of weight loss. Because one of the big questions in the field is, it's nice that it's improving health, but how much of this effect is just simply due to losing weight? Is TRE just a fancy way to lose weight? And so to test this out, we did a 5-week-long crossover randomized controlled feeding trial in men with prediabetes. And we tested time-restricted eating using a 6-hour window, which is pretty extreme, but this was sort of more of a proof of principle study versus a 12-hour eating schedule. And essentially what we found is that eating in a 6-hour period early in the day was much better for reducing insulin resistance. It lowered blood pressure by about 10 points, which is pretty dramatic. Although I will say most of our participants also had hypertension. It also improved beta cell responsiveness, which is sort of the ability of the beta cell to produce insulin, and it reduced markers of oxidative stress, similar to what Walter Longo has mentioned for the fasting mimicking diet, though we found no effects on lipid levels. And now today we have a total of 8 studies that report TRE has benefits independent of calorie restriction. In fact, I think I can think of only one study that found no benefit, but just to know our results have been replicated and extended by other groups. For instance, one particular group, Jones et al., they found that 2 weeks of early time-restricted eating, similar to what we studied, improves insulin sensitivity as measured by glucose uptake into skeletal muscle, as well as branched-chain amino acid uptake into skeletal muscle. And here's some of their results for insulin sensitivity. And then we've also done other studies in our lab. We were one of the first to look, I think we were the first to look at 24-hour glucose levels as measured by CGM. And we found that only 4 days of practicing time-restricted eating by eating early in the day improved 24-hour glucose levels, as shown here by this sort of thick black line. And interestingly, we sort of originally thought, well, most of the effects will probably be due to the time of day of eating or the longer fasting duration. But it actually looks like perhaps most of the effects are actually due, if you look at the second lunch meal of the day, it looks like a lot of the effects are due to eating meals in succession before glucose levels return to baseline, and that you get this sort of second meal effect whereby you already have excess insulin in circulation. So if you start your next meal before insulin levels have returned to baseline, that actually can reduce the spike or subsequent glycemic excursions. There's also evidence that TRE can improve some, but not all aspects of cardiometabolic health. And where we see the most promising data is for blood pressure and some related aspects of health. So for instance, I think we now have 24 studies of time-restricted eating. And meta-analyses now consistently conclude that time-restricted eating does reduce blood pressure. And this includes studies even in patients with hypertension. And then there was a really nice study that was published about 1.5 years ago in patients who recently experienced myocardial infarction. And they actually found that time-restricted eating actually improves left ventricular function, as shown here. And then a very nice study that I was a collaborator on in older adults, that was a crossover study, found that time-restricted eating actually improves the 6-minute walk test and actually reduces heart rate while exercising, which a couple other studies have found as well. So it seems to somehow also improve physical function in some ways we don't understand that are independent of exercise, at least in older adults. So I think that's a very cool area worth watching. In terms of effects on lipids, we really don't see a big improvement in lipid levels unless TRE is also accompanied by greater weight loss. So if you look at all the studies out there, about 75% of them report absolutely no effects on lipid levels, or at least fasting lipid levels. But there is some evidence that TRE may affect other aspects of lipid metabolism. So one study in 24-hour shift working firefighters did find that TRE positively affected VLDL particle size. And then another study, which was actually done in primates found that TRE actually reduces HDL, actually improves HDL size and content and improves cholesterol efflux. And that was true in both sort of younger adult monkeys here, which is these open bars, as well as in geriatric monkeys. So very nice result there. And then lastly, I also want to talk about what we more traditionally think about as measures of well-being. So there's evidence that time-restricted eating can also improve things like mood, quality of life, happiness, and self-esteem. So we were one of the first to take a look at this. We did a 14-week-long RCT in 90 adults with obesity, and we found that time-restricted eating actually improved vigor activity as measured by the PALM short form. So you can think of this as sort of self-reported energy levels. And it also reduced fatigue and then sort of feelings of depression and dejection. And in a per protocol analysis, we even found later that it reduced feelings of anger and hostility, which we were quite surprised about. And it also reduces sort of total mood disturbances. Now, it's not clinically reversing folks who have depression and making them depression free, but it is still shifting people more in the right direction. And there have been some other studies also finding some encouraging results in this space. So for instance, there was a 3-month-long RCT in 30 healthy adults where they had patients follow an 8-hour time-restricted eating schedule, and they found that time-restricted eating improved quality of life. It also reduced fatigue, both mental fatigue and physical fatigue, and it improved, reduced pain, mental and physical function, pain, mental and physical, pain, physical health, and mental health, as well as a couple other constructs, including health perception. That said, there are some quite notable studies of time-restricted eating that have reported either null results. So for instance, I can think of a famous study published in JAMA Internal Medicine, where they had participants practice TRE by skipping breakfast. And those participants ate later in the day and stayed up later at night, and they found no benefit from time-restricted eating. And there are even some studies that have tested TRE quite late in the day. So for instance, by having individuals skip breakfast and lunch. And some of those studies have actually reported negative effects. So one of those studies, again, done by Mark Mattson's group a long time ago, they randomized participants to either eat 1 meal a day starting at 5 p.m. in the evening. So this would be kind of like late in the day, very late in the day, or to eat 3 meals a day. And they actually found that eating that 1 meal a day late in the day actually worsened glucose levels, insulin levels, blood pressure, and cholesterol levels. So this suggests that the time of day that you practice time-restricted eating may affect at least some aspects of health. And this makes sense because we now know the body has an internal biological clock known as the circadian system, which produces 24-hour rhythms in our physiology, metabolism, and behavior. So for instance, your best coordination and greatest muscular strength and fastest reaction time are in the afternoon. Your body starts to produce the hormone melatonin in the evening, which helps you sleep. And then your sort of greatest alertness and testosterone production. And in most people, their best glycemic control is in the morning. And in fact, we've known for over the last more than 50 years that if you give someone an oral glucose tolerance test in the morning, say at 9 a.m. versus the afternoon and the evening, despite the fact that you're giving individuals the same load of glucose, blood sugar levels spike significantly higher in the afternoon and the evening, suggesting that oftentimes when we're eating dinner, individuals who otherwise have normal blood sugar, many of them are equivalent to being pre-diabetic. So borderline pre-diabetic at dinner. So just to say, like, that dinner meal may actually be really important in terms of what people are doing. Or said another way, we should probably try to avoid eating large meals or unhealthy meals quite late in the day. And in fact, we are starting to see more and more studies testing time-restricted eating by eating early in the day versus late in the day. And I'll say at the moment, the data is kind of mixed. I will say a majority of those studies find no major differences in weight loss, but they are finding differences in other aspects of cardiometabolic health. So some of those studies, like the one I'm showing here, do report greater improvements in glycemic endpoints, such as fasting insulin and HOMA-IR, with early time-restricted eating, and they're also finding greater improvements in blood pressure with the early time-restricted eating as opposed to the late time-restricted eating. So we'll continue to watch this space. I think it'll be interesting. So to sum up and give you some high-level take-home points, I would say, first of all, really important lesson, I think not all forms of intermittent fasting are feasible. As we've seen, some of these are really hard to stick with in the long term. I think if you were to ask my opinion, I think the three most promising are probably the 5-2 diet, the fasting mimicking diet, and time-restricted eating. Second, I think the data in literature clearly suggests that intermittent fasting induces weight loss and improves cardiometabolic health, at least relative to sort of habitual eating patterns. Intermittent fasting may also combat several age-related diseases, in particular type 2 diabetes, fatty liver disease, hypertension, and potentially even cognitive decline. Now, when you compare intermittent fasting to calorie restriction, the data suggests by and large that intermittent fasting isn't much better, with some exceptions. I think we are seeing some evidence that time-restricted eating, at least with an early eating window, may be better than CR, or certainly better than any sort of calorie-matched approach. But by and large, intermittent fasting seems that most of its benefits do seem to be from reducing calorie intake. And then lastly, there's evidence that intermittent fasting can improve energy levels and fatigue and improve mood, quality of life, mental health, happiness, and confidence/self-esteem. And with that, I'd like to thank all the folks who were involved in generating some of the data from my lab included in this presentation, and then thank also our grant support and our sponsors, including the NIH and Department of Defense. All right, thank you so much.
Thank you very much. That was